redness, swelling, or lesions. I'm going to look in the back side of your ear now, Deja, to see if I can assess for any skin breakdown. No skin breakdown back here. I am going to now palpate. You let me know if you feel any discomfort or tenderness, okay?
Okay. Nope, it's all good.
Okay, tragus palpation.
Still good?
Good? Okay, great. I am going to move on to your mouth now, okay, Deja? I'm going to have you open your mouth for me. Okay, as I'm looking inside the hard palate, as I'm looking inside, the teeth are china white and they are appropriately aligned to the jaw. And as I'm looking at your soft palate, it is pink with a yellow tinge, and your hard palate is pink with a gray tinge. As I need you to stick your tongue out and say ah for me.
Ah.
And your uvula rises upon phonation, which is good. As I was looking in there, your mouth was free from any exudate, any candida, any redness, swelling, and your mucosa was pink, your buccal mucosa and your tongue, which we like to see. And so now I am going to move on to your lymph nodes, Deja.
Okay.
Before I leave your head, I want to make sure that we check these lymph nodes. So I'm going to do a circular motion along your lymph nodes, and you let me know if you feel any tenderness, pressure, or anything, pain or discomfort, okay?
Okay.
Okay, so we're gonna start with I'm gonna have you turn your head to the side for me if you can. Your preauriculars, your postauricular, your occipital, your posterior cervical chain, your deep cervical chain, your anterior cervical chain. I'm going to do your submental, your sublingual, your submandibular, your tonsillar, and I'm going to have you roll your shoulders forward for me, Deja, like that. Great. And I am going to check your supraclavicular. Did you feel any tenderness?
Nope, I'm all good.
All good? Okay, so now I am going to move on, or if I would, there was no tenderness, no palpable lymph nodes, and that means that you are free from any signs of infection.
Great.
And now I want to look at your chest, so I'm going to have you sit up in your most comfortable position for me. Okay, great. So as I am looking at you, there seems to be no presence of kyphosis, lordosis, or scoliosis. As I am looking at your chest wall, or your chest is at a 2-to-1 ratio in the transverse plane. I am looking at your chest diameter, and it is at a 96 or 90-degree angle. And now I am going to move on to touching your chest. And so I'm going to touch, and you let me know if you feel any tenderness, okay, upon my touch. I'm going to touch the front.
Nope.
No, I don't see you sitting in a tripod position, so I'm assuming that your I'm assuming that your work of breathing is fine. You don't seem to be in any distress, so now I am going to have you turn to the side for me, and I am going to get down and perform a chest expansion. I'm going to hold my hands at T9 and T10, and I'm going to ask you to breathe in and out for me. Deep breath. Okay, and so your chest expanded bilaterally when I held it down at T9 and T10, okay? Symmetrically, I'm sorry. I am now going to perform a tactile fremitus, so that is going to consist of every time I touch your hands with the owner side of my hand, I'm going to ask you to say the words 99, okay?
Okay. 99, 99, 99, 99, 99, 99.
Okay, and so the vibrations were symmetrical and felt throughout, clear throughout. I am now going to have you turn around for me, and now I am going to listen to your lung sounds. Okay, I'm actually going to start with your back. I'll move over this side for you, so we can start with the back.
Excuse me.
Oh, you're getting tired, huh? Okay, so we are going to start with your left side, okay? And every time my stethoscope touches you, I'm going to need you to breathe in and out for me, okay?
Okay.
All right. So we're going to do your left upper lobe, your right upper lobe, right upper lobe. One more time for the right upper lobe. Left upper lobe. Left lower lobe. Right lower lobe. Lift your arm a little bit. Left or right lower lobe again. On the same side. Left lower lobe. Okay. Your lung sounds were clear and vesicular throughout on your backside. I'm going to do the same on your front, okay?
Okay.
Okay. So where's the camera for this one? So we're gonna just go in the opposite direction, okay, Deja? So we're gonna start with your right side.